I'm here today with Jon Neikirk from Froedtert. Thanks for joining us, man.
Thanks for having me.
It's been great to get to know you a little bit. We really appreciate it. As you know, we're trying to get some dialogue going on all things innovative in the revenue cycle. Folks that we're talking to, it's either incremental improvements, some people are trying to do things in a big disruptive way, in a transformational way. But just to kick it off, you're a revenue cycle warrior in the industry, one of the veterans.
One of the veterans, yes.
You know all the use cases, you know where all the dead bodies are.
Yeah, we're doing it way too long.
So is there an area, what are you excited about in this general topic?
Yeah, well, I think there's a lot of things to be excited about, but one of the things at Froedtert we're focusing a lot on now is automation. So
yep.
I think everybody probably is doing the same thing. It seems like a common theme. Labor costs are rising, and you can't find the people, so it's easier to build robots than to hire people these days. And so, and so that's really where we're trying to expand our focus and really invest as from a revenue cycle standpoint, and in other areas as well within Froedtert.
Yep. So when you decide, okay, we have the revenue cycle, everybody has their different, I like to say there's 34 nodes, because I'm a revenue cycle geek, and I have 34 nodes of the revenue cycle from pre-service to zero. But the challenge can be, and even in the last conversation, where do you start, right? It's how do you know? Do you have a process that you go through? You say, hey, I'm going to put some money in the budget for automating the revenue cycle, okay? And then where do you decide to start?
Well, we decided to start where we've already invested, and that's with Epic, because there are some automations that can be done in Epic, a lot of them actually.
Sure.
And Epic is investing in that space as well, so we've got a ton of money in the budget for Epic. I mean, Epic is not an inexpensive EHR, and one of our biggest wins has been with what's called simple visit coding, and it's taking all the outpatient coding and automating that process.
Sure.
So for Froedtert, that was some low-hanging fruit and a really big win for us. And
so you're talking about lower acuity, like level 1 and level 2, ER and office visits?
Simple outpatient cases that previously required a human to go in, enter the codes, and
one CPT, 3 diagnosis codes kind of stuff.
More straightforward outpatient visits. Nothing complex like day surgeries or anything like that at this point, anyways. So, so for us, it's been a win in that just from a labor standpoint, we were, a lot of times we say we're going to reallocate staff or things like that. We were able to actually eliminate a number of positions from our coding workforce. And for Froedtert, that amounted to $1 million on an annual basis. And,
that's
significant for us.
Does that get people excited? I always love stories like that, because you do something that's targeted and you get $1 million, and then that creates excitement, right?
It doesn't get our coders excited, but everybody else gets excited about it.
Well, the bots are coming.
They're coming for us.
Just like Detroit, it's time to upskill.
Yeah.
That's what I tell people.
Exactly.
Make sure you sharpen the knives of your own skills and training. And
yes. Yep. Yeah, so we'll continue to work on automations within Epic, I think, as something that we've already invested in, and that doesn't take additional money in the budget, but we know that can only go so far. So additional things outside of Epic, you mentioned the incremental, trying to do some small things.
Sure.
One example also in our coding area is we've got a bot that just sends physician query follow-up emails to our docs. Previously that was a coder that had to sit there and type emails, hey, did you, and a bot just, as a cadence that it sends out those emails on. Smaller win, but we've got some of those incremental type
things like
as well.
Physician dictation too, getting the docs to finish their dictation.
Yeah, we haven't implemented that one yet, but that's a very similar bot.
Similar use case,
similar use case. So there's those types of things, and then as we look forward, I think there'll be some bigger automations that we try to do with more AI and machine learning, where we can automate more of an entire process. We're looking at doing that with prior authorization right now. So I think that'll be something where we say, hey, we're not going to build a bot to do one little piece of the process. We're going to build a solution that can automate the entire process.
How do you think about vendors and partners to help with innovation goals? There's so many niche, just look on the floor, right? Everybody has a niche solution.
Well, and I would say for us too, we have so many vendors that we work with right now. There's definitely some, just like we're trying to do application rationalization within our IT department, we need to do some vendor rationalization and try to reduce the number of vendors we have rather than expand them. So if we can find a vendor that can work in many spaces across the revenue cycle and other areas, that's sort of where we'll look at partnering. Rather than trying to find these niche vendors that can just do one little thing. And as you know, the industry now is going to, it's more of these, platform vendors that, like, we've got an entire platform that you can purchase. I'm not saying that we're doing that for automation, but certainly we would look to something like that to be maybe how we go forward, rather than trying to find a vendor for every little bot that we want to build.
Yeah.
So.
How about sort of like post-COVID? Were you guys, where are you with work from home? Are you half and half, hybrid?
In the revenue cycle, we've got some hybrid workers, mostly remote though. Everybody, we send, just like everybody else, send everybody home in a hurry, and then, now they're productive and working from home, and it's been good. It's been good for Froedtert. It's been good for, I think, our workforce. We lose a little bit from a culture standpoint, I think. You don't have the human interaction, but that's part of the trade-off, I guess.
Yeah. Do you find, I've had discussions even today with, it's hard, back office and patient financial services, it's hard to have, it's hard to compete even with Arby's and Walmart. And are you guys facing challenges like that as well?
Yeah, very similar challenges. The wages continue to increase. We continue to raise our minimum wage to compete, and it really puts stress on the margins of the health system, of course. So as we look, and as our CEO looks at where can we find some savings, revenue cycle is at the top of the list. So thus our need to automate and figure out how we can take costs out of the revenue cycle.
You guys do any form of incentive, like gain sharing with the staff? If stretch goals, if you hit this threshold, it always seems to be this very challenging thing in healthcare.
Yeah,
but if you're going to be competitive, if we're all competing for different, if fintech industry and other industries are competing, we got to do more to offer to be competitive, in my mind.
Yes, and for our leadership staff we do that, but not the line level yet. So maybe something yet to come in terms of unique compensation models, I think.
Yeah.
We have to first be able to keep our compensation analysts, because there's some of the folks who are leaving.
Oh,
so,
yeah, there you go. It's like a vicious circle.
Yeah, HR is having their challenges too, recruiting and retaining. So.
What about the front end? There's a lot of folks doing things on the front end of the revenue cycle, offering fintech solutions, patient engagement, taking friction out. Are you investing there as well?
We are. We're in fact just launching on a multi-year project to set up an engagement center for the health system.
Oh, okay.
So the vision
an
there. An
engagement center, that's a new one. I like that.
Yeah, it's really the one call, that's all, one-stop shopping. So you can be a customer of Froedtert and call one number to, ask a question about your bill or get your appointment scheduled, or nurse triage, prescription refills. And I think that's a differentiator that Froedtert's looking at.
Yeah, that makes a lot of sense.
If we could really do something like that. So I think patient access and our registration and scheduling areas are, kind of first up to say, how can we get all our scheduling in one spot, and how can we make it easy for our patients to schedule? How can we create that access there? One number for scheduling, not a different for each specialty. That in itself is going to be a year-long project, just trying to bolster our ambulatory scheduling area, and then from there we'll move to ancillary and other type services. We've got some consulting resources that have done this elsewhere that are helping us with that project, but that'll be also an AI-enabled function. So we'll have sort of at the center of it all the AI attendant that answers the calls and figures out how to triage the calls, put them where they need to go. So even on the front end, I think we'll see from a scheduling standpoint much of that automation coming into play.
Operationalizing all of these ideas can be tricky, and you mentioned the notion that some FTEs are not liking the robots. How do you educate the team and deal with like change management? Change management is such a critical ingredient of driving transformational change.
Yeah, I agree, and I kind of look at change management like sales. So we've got something we need to sell to you, and it's this change, and here's what's in it for you. So in the case of coders, right, not all of them lost their positions, right? Some of them were able to say, hey, we're going to have you working at the top of your license. We don't need you coding all these simple visit accounts. We get openings in day surgery and inpatient. Let's get you up to speed on some of those other areas. And I think we'll do that in elsewhere as well, where we can say, hey, here's the top of the license work that you could be doing. So let's look at automation as an enabler rather than a threat. And easier said than done, right? That sounds good just saying it, but actually kind of getting that to stick is hard. It's the
nuance, it's like soft skills or EQ kind of stuff. You can't overinvest in that, right? That's how you'll get the biggest bang for your buck is if there's something in it for them.
Yep.
Right.
And today you mentioned earlier that the remote work, it's harder to engage staff, remote workers in those types of conversations when, all right, you're just looking at the computer screen, there's no interaction, you can't stop in the office and ask me a question afterwards about what was said, and every interaction has to be, we're going to schedule time to talk about something. So I think change management's become harder with the remote workforce, getting those conversations, the crucial conversations as we call them, having those over WebEx or a phone call is just not the same as
fireside chat kind of, yeah. Town halls and fireside chats, right?
Yeah, those are all virtual town halls and fireside chats.
To some degree, we found when we do that stuff, people like it, right? It's everybody go grab a cocktail and let's talk about things that need to be done, and you're not having to fly people in. And one thing I wanted to talk, just if you think about 5 years from now, right? Where do you specifically want to be in your organization? Like, what are a couple of things that you would love to say, we got that done? I automated 100 FTEs on the back end of the revenue cycle, or I automated, 50% of coding, something like that.
Yeah. Well,
what's possible?
Yeah.
Trying to balance where you want to be with what's pragmatic.
Yeah. Well, and it's good you said that. Our goal is a fully autonomous revenue cycle, but I don't know that we're going to get there in 5 years.
Yeah.
In 5 years, though,
I'm even excited to hear you say that. Right.
It's very aspirational, But,
sure, but it has to be.
And I think in 5 years we'll make progress towards that end. But I think the middle of the revenue cycle gives us such a large opportunity right now. When we talk about coding, pretty soon computers are going to be coding everything, I think. And so we started with some of the simpler outpatient stuff, but just having conversations with some of the technology vendors today, there's a lot of work going on in that space. I think there's a lot of opportunity on the front end of the revenue cycle in areas like prior authorization. We talked a lot about a frictionless revenue cycle, and that's one of the areas where there's a lot of friction. The denial space, how can we automate some of the processes of getting the data back and forth such that both parties can agree that, all right, this isn't going to be a denial, we trust the process. And so that frictionless automated revenue cycle, I think, starting on the front end with areas like prior authorization, coding, then on the back end, a lot of the insurance follow-up, the claim status, even submitting, we're building a bot right now to do claim submission medical records when we get denials from payers. So again, just trying to eliminate some of the manual intervention there on the back end. In 5 years, much more than that we hope to have automated on the back end though, right? We shouldn't have to be picking up the phone call and payer, hey, what's this at? All that kind of stuff, right?
That's a good point too, is that I hear a lot of folks appropriately say, you got to get the payer involved in these discussions too. When payer and providers get together and talk through a few accounts, it's like they should be talking about innovation. How are we going to innovate together? Cost to collect, cost to adjudicate, that can all come down and create more value for the patient.
It's a win-win if we structure it the right way.
Yeah.
The administrative burden on issuing denials, reviewing records, all those types of things, it's a burden for the payer, it's a burden for us. That's way easier said than done, right? I mean, it sounds good to us, and the payers obviously, we've had these conversations, they say it sounds good too, but actually getting there practically is, it's going to take some effort. But somewhere that's definitely worth investing that effort.
So just so I can pin you down on an answer, you think a third, a half, what?
Of how much of the revenue cycle will be automated?
Yeah.
Overall, I'd say somewhere between a third and I'd say a third. I'll go with a third.
That's not
conservative. I'll give you a conservative.
That's not bad, right? There's a lot of value there, because if done properly, would you agree that you're improving yield, you're improving patient satisfaction, and you've taken waste out of the system?
Yes. Yeah, that's the other thing about automation too. It takes errors out of the system as well. Those manual errors that are made. I think that's another opportunity that sometimes people don't think about. We think about the labor cost reduction, but it also reduces errors, and that's ultimately going to lead to improved revenue potentially and fewer denials. So yeah.
All right, a third is exciting.
Well, and the pace that these companies are innovating, to try to automate some of these processes, it keeps speeding up, right? So if we partner with if we find the right partners,
yep.
I don't think that's unachievable.
Yeah, no, I don't either. I think it's all, it starts with leadership commitment at the board and C-suite. Are you going to put actual money in the budget, and are you going to start getting after it? There can be no kicking the can down the road on this topic.
Yep. Well, and we have support. If we can show the ROI or the proposed ROI, we've got support to bring in the IT resources to do the work, and I think that's half the battle. I think anybody will tell you IT resources are always so constrained, but if there's a return there, then it's just like any other investment. 5-to-1 ROI, okay, let's make that investment.
Well, hey, John, I really appreciate you coming by. It's been great chatting with you. You've added a lot to the dialogue, and for that, we're thankful, and let's definitely stay in touch. We want to do more and more of these.
All right, thank you. Thanks for having me.
Yeah, absolutely. I'm glad you're coming to the party.
Yes.
All right.
Thanks again.
All right, cheers.